traumatic brain injuries are a very serious event that can ruin a person's life forever. When you think about a traumatic brain injury, people think about skull fractures, brain bleeds, subdural hematomas, and other very serious injuries to the brain. These occur. We see them all the time with our veterans coming back from war, who've been involved in explosions and vehicle crashes. However, traumatic brain injuries are a frequent event that occur just to our ordinary citizens here in the United States. Statistics show that there are over 3.8 million brain injuries every year in this country, resulting in over 250,000 hospitalizations and over 50,000 deaths. So traumatic brain injuries are significant. However, there are something called a mild traumatic brain injury. And a mild traumatic brain injury is really a misnomer, but it is a traumatic brain injury nonetheless. It is just not a severe traumatic brain injury that's resulted in brain bleeds or subdural hematomas that will be picked up on a CAT scan or MRI. So if you've been in an accident or you've had a slip and fall, it's important to see if you may have sustained a mild traumatic brain injury. The most important thing to look at is whether or not there's been a period of unconsciousness. And most people who are unconscious don't know that they're unconscious. It's hard to tell if you're unconscious. So the most important thing to ask is, what's the last thing that you remember before an accident? And what's the next thing you remember after the accident? Very frequently, you will find that there is a gap there. Sometimes it's just a matter of 10 or 15 seconds. Sometimes it's a matter of minutes. However, if you have a period of unconsciousness and you have a period of amnesia, you've probably sustained some sort of a traumatic brain injury. Hopefully it will be mild, but it needs to be checked out. So here at Rue Ziffra, we always ask our clients if there's been a period of amnesia or unconsciousness. And then we have an 80 checklist that will delve deeper into determining whether or not there's incidences or signs of a traumatic brain injury. Some of those are common things like headaches and nausea, blurred vision, ringing of the ears. Those can all be signs of a concussion or a traumatic brain injury. However, if a person's irritable or can't sleep, or there's been a change in personality, stuttering, confusion, coordination problems, all of those can be signs of a traumatic brain injury, even if the MRI and CT of the brain is normal. So in doing this checklist, if there's a significant number of these signs that are popping up, then a person needs to be tested to see if they've sustained a mild traumatic brain injury. The way that is done is you can get a neuropsychological examination, which is a series of questions that probe into the different areas of the brain to show inconsistencies in a person's statements or memory that can show signs of a traumatic brain injury. In addition, we can do a T3 MRI or a DT MRI, which can show changes in the functioning of the brain. In addition, we can also do a neuroquant examination, which looks for early signs of brain atrophy that can lead to dementia or Alzheimer's or stuff like that. So if you've been in an accident and you've been hit with an airbag or you hit your head on the side, it's very important for you to look in and see if you have a period of amnesia or if you have any of these signs that can be indicative of a mild traumatic brain injury. If you've been in an accident and you're not sure, call Rue Ziffra. Rue Ziffra and your community on your side.